For the next 50 minutes, we will have a wonderful session on crisis and emergency risk communication. And to start this session, I'd like to introduce Catherine Lyon Daniel, CDC's Associate Director for Communications.
Hello, thank you again so much for being here today. This is the session that you will need to remember. You won't need to remember every little bit right now, but there will come a time when you will need to look back into your notes and refer to this and learn from them, call somebody, talk over what you'll hear about today. Before we move into the aspects of crisis and emergency risk communication, I did want to say that, well, first of all, you'll hear two talks. We won't have a question and answer period today, but the speakers have both indicated they're available for Q&A afterwards, and they will be available to you for technical assistance throughout this response. The issue is that there's a lot of planning that's already happening. There's a lot of communication work that's already happening, as you just heard. That campaign planning, that awareness planning, that education planning and strategy is all critically important. CDC is working on many ways to provide resources to you and to help you in those times. I want to point out, and you have some of these in your packet under tabs C and D. There are key messages, SACOs as we call them, single overriding communication objectives, right there for you. You don't have to create your own, but I encourage you to tailor them to your local areas. Social media, both messages that you can retweet or repost, or that you can build on for your own opportunities. Other kinds of products, both for clinicians, for pregnant women and their families who are incredibly worried already, and for the general public who want to learn more. Media templates for you to use. You all know how to do these things, but if you can start with something and focus on tailoring it for your audiences, that allows you to do more. There's a list and links to other CDC resources in your packet, and I hope you'll use them as you think ahead. We also will be coming out with a variety of communication products, including videos and other things, both in English and Spanish, for the future. Now, I do want to say that all of us can do this planning and preparation, but when the you-know-what hits the fan, which may happen with the onset of mosquito season, or it may happen with the first case in your jurisdiction, people will look to you for the answers about what to do and what to say. When that happens to me, I can't think of two better people to have in my corner than our speakers today. The first person you'll hear from is Dr. Barbara Reynolds. She is the founder and creator of CIRC, Crisis and Emergency Risk Communication package, which is also available to you. And Dr. Lenny Marcus, who is the co-director of the National Public Health Leadership Initiative out of Harvard University. I welcome them both. I know that we'll be referring to their work many times in the future, and we'll start with Dr. Barbara Reynolds.
Thank you so much. I want to do a little definition of crisis and emergency risk communication. It's actually the kind of communication that leaders will do along with their experts to help people and communities make the best possible decisions when the information is imperfect and we're under impossible time constraints. So what we have is actually a communication approach or a framework that helps us communicate in those kinds of situations. And we know already from the conversations we've had so far today that while we are learning more every day about Zika, there are still a number of questions. There is some level of uncertainty. And it may be actually surprising to learn that people can accept bad news more easily than they can accept uncertainty. So as we work through these questions and try to get to these answers, understand that there is a tremendous expectation on those of us who will be communicating to the public, and especially those who are at most risk from Zika virus. I put this slide up with real reverence because I've experienced it through my career, and I tell you that this is absolutely the truth. The right person, the right leader, at the right time, with the right message, can literally save lives in a public health emergency. And in this situation, we're going to have to talk to people about difficult topics. And I want you to be reassured that there is a framework, a way to go about having those conversations along the way. And we also have to be prepared to tell people what we know and what we don't know. There isn't a magic wand or a perfect message that's going to help us move through this. But if we start from the perspective of what does the public seek from us when they're facing a health risk, a public health emergency of some sort, they've told us what they want. And of course they want the facts. That's not a question. Oftentimes I think that our leaders stop at the facts. What we have to understand is we have to go a little bit further to give people what they truly need to make those good decisions, even though the information is imperfect and the time constraints are impossible. We need to help empower their decision-making. I was thinking about you all on the way to work today, and in Atlanta we have a long commute. And I was thinking, how do I get past this so that you really understand how important this idea is of empowering decision-making? It's, you know, a word that we toss around, but what does it mean? What it means is giving people not just the what to do's, but the why to do it. And if you consider that, all of us want to understand why, especially if somebody tells us not to do something. Isn't that true? I mean, I think I revert to a 3-year-old at that point. Why? Why? Why can't I do that? So sometimes when we're experts, sometimes when we're enmeshed in a response that's demanding of our time, we want to just give them the message, tell them what they need to do, and move on to the next problem. Take a moment, slow down, give people the facts, but give it in a context that they can understand why you as an expert have suggested or recommended or are guiding them to take a particular approach to the problem. So think through it just long enough. We don't have to bore them. Oh, I shouldn't have said that to a scientific group. We shouldn't have to give them every aspect of the science in the situation, but we do need to give them enough that they can understand and feel as if they would make that same decision in the situation given the facts that we've given it to them. And look at this, involved as participants, not spectators. We're actually fortunate. I don't think you expect me to say that kind of thing around Zika response planning, but we're kind of fortunate that we have a situation where we can actually involve the communities that we're going to be talking to as a part of this response. It's a gift in its own way, and we'll talk about that a little more. This is the money slide. This is where it goes wrong. By no means do I suggest that this is the only place and the only things that we do wrong. But the more of those that stack up, the bigger our problems will be. And I would like to tell you that a poor operational response cannot be saved by good communication. I can also confirm that a good operational response can be spoiled by poor communication. I know we're busy here today thinking through the myriad of tasks that need to be done as we go about our Zika action plan process. But please give serious consideration to what is being done in the communication arena. A false step in this area could undo a lot of good that you've already tried to do in the response. Be careful with a paternalistic attitude in this response. The idea, you know, don't worry, little lady, we got you covered. you know, kind of doing that John Wayne thing. That's not going to work. We're adults. We want to be included in the process. And the sooner we do that with our community, the more successful we will be. Watch out for those mixed messages. I appreciated everything I've heard so far this morning when there's been talk about communication and risk communication. People are spot on with what needs to be done. Because I don't have in there a list that says incorrect messages. Of course we know incorrect messages wouldn't be a good idea. But even when we mix the messages, however, we've already acknowledged in the earlier panel that there's going to be a patchwork of response, different concerns at different times in different places. So we do have to work toward consistency, and I think acknowledge up front that what is working in one place is not necessarily what will work in another place. But then we have to be prepared to answer why. So we have to back it up. Rumors. Leaders, rumors are going to happen. Don't discount them as fanciful. Like, how could any reasonable person believe that rumor? Rumors have always existed. It's just that now, because of social media, we're more aware of them, and we should be grateful for the fact that we can be aware of them more quickly. But we do need to address rumors when they pop up. There are psychological barriers to any communication when people are feeling threatened. What's a psychological barrier? It's something that gets in the way of people hearing the important message that you have in that situation. Denial occurs most often when people are somewhat aware of a threat, but perhaps through coping have decided that there's nothing they can really do about that threat. So the more that we can give people power over decisions and give them actions, things to do, the less denial we'll see. It's frustrating when people start to discount where we are. Fear, anxiety, confusion, dread, emotions that we can expect to have happen. I want to be very specific about what I'm saying next, because it's going to be a little surprising. It is not your job to make people not be afraid. What? More often than not, when I see poor decisions being made about what is communicated to the public and when, it's because we have an unreasonable need or belief that it is our job to make everybody not be afraid. And then what happens is we start to soften messages in a way that makes people perhaps less concerned, and maybe they're not taking the actions that they need to take. So really, is it our job to make people not be afraid? No. Our job is to help people manage those emotions so they don't fall into hopelessness or helplessness. Because if they do, that's when we've lost them. And there are ways, and we'll talk about that, ways that we can help people manage their fear. But if we become so obsessed with the idea that if anybody's feeling strong emotions about the issue that we're responding to, that we failed in some way, we're going to fail. I want you to work as leaders with your public information officers who have the expertise in this arena to come to messages that give the right balance. We don't want people so frightened that they fall into denial and because they don't believe there's anything they can do, but we don't also want them to become complacent and not do the things that they need to do to protect themselves and their community. I have seen over the years that people often talk about changing messages based on the fear that people will panic. Panic behavior is actually very rare. But if it does happen, the research tells us it happens when there's no credible authority and all options seem equal. So what we should be working toward is being as credible as possible at every stage along this response. All risks are not accepted equally. In any threat situation, when people are looking at a new risk especially, all of those things on the right-hand side of that slide The more of those that exist in the situation, the greater the emotional toll will be on the public, the people who are exposed to whatever that risk or threat is. They say if you have 3 or more, you got yourself a real problem. Well, let's walk through this with Zika. For some, it's going to feel involuntary when it shows up in their community. For others, it will feel voluntary because they're making decisions about whether they'll travel to an area where it exists already. Some will feel that it's outside of their control. Others will feel that it is in their control. It will be considered exotic, I believe, by most. In fact, even the darn name is a little exotic, isn't it? So that can be problematic. It is natural, but there are other associated concerns that may make it feel more man-made risks when we start to talk about vector control. It can be reversible or it can be permanent, depending on the person that we're talking about. Anecdotal, that means when people are hearing the stories. We've already seen pictures and heard anecdotes about the effect of Zika virus. And so we know that people will have an emotional toll from that. More than anything, we're talking about something that affects children, and therefore people's emotions will be higher. It goes without saying, but it needs to be said because I think early on in crisis response and in our first initial contact with the public when there is some threat or risk that we're talking about, we may have the tendency to overpromise. And it's our good-naturedness. We really want things to work out well. But even implied promises will be held against us if we don't make them happen. A very useful way to go about ensuring that you don't overpromise is to talk about process. And it's reasonable, especially at this point in our planning and response to Zika, to help people understand that there are things going on. We don't have to promise the outcome. What we have to do is share with them. Remember, they want to be involved as participants, not spectators. Share with them what we're doing and let them in on the process. We talked a little bit about fear. Remember, I told you it wasn't your job to make fear go away? I want to go a little further. Fear is natural. In fact, fear can be protective. It's important that we don't be judgmental toward people who may be afraid of something that we're not afraid of. We may have some expert knowledge. And if we do have expert knowledge, I suggest you go ahead and share it. But when you do share it, please do not finish that conversation with, and therefore, there's no reason to be afraid, okay? And in fact, one of the ways that we can help people manage their fear is to acknowledge it. It doesn't take much, just put into words. We understand this is a frightening situation for some. It's as simple as that. We appreciate that acknowledgement of our fears. We don't want people to tell us not to be afraid. I don't know if you have any phobias. I have a big one. It's called spiders, okay? And I don't want somebody to tell me there's no reason to be afraid of spiders. I just want them to tell me something nice about spiders and then acknowledge that it's okay if I'm afraid of spiders, right? So be careful in the way we manage fear. Sometimes I think in a long response that we start to become frustrated and intolerant and perhaps judgmental of people who are fearful. We may even start to label them in some way. Try not to do that. Try to use your empathy muscle in that situation and allow them to feel what they feel and educate them as they move along through this. We have 6 principles, 3 of them on this slide and 3 on the next, that we believe are a useful framework from which you can start to develop your messages, again, with your public information officers who have this expertise. I know it's tough in an age with social media, and I wonder if we're still trending, to be first. But what I'm saying is, go ahead and make the decision to release information. In the planning that you're doing right now, you should be working with your PIOs to determine where and when and how will we release and then fill in the blank. When this happens, when that happens along the way. Even predict to your community that you will be doing this and how you will be doing it. It's reassuring to know that there's a process, there's an expectation that this information will be shared along the way. And this is an important thought. If you're not prepared to answer the questions and provide the information, one, it will appear that you're less prepared than perhaps you are. And two, you leave a vacuum. You leave a gap that may be filled by people who do not have the public's best interest at heart. So to the extent that you can think it through with your PIOs and prepare to share information early, the better off we'll be. And by no means do I suggest we get to have a shortcut and that the information doesn't have to be right. I'm actually, after a long career in this field, am grateful for social media because it's teaching all of us that information can be given out in increments. There was a time when we wanted to have every question to every answer ready to go before we would meet our publics. We're getting better at that, so take advantage of what we're learning in the social media arena and use that in crisis situations too. Credibility is a big word. I think it's easily defined here. If I had a whole day with you, I could spend that whole day talking to you about the importance of empathy in crisis communication. When people are feeling threatened, perhaps when for them their lives feel like they're out of control or turned upside down. Empathy is our ability as humans to understand what someone else is feeling. It isn't a requirement for you necessarily to feel it, although many of us do. Unless you are a sociopath, you have the capacity to be empathetic. Now, the problem is, as response officials, as leaders, we oftentimes have squashed that, and we believe that we shouldn't be talking about that emotional stuff, the way people are feeling. But actually, it's a very important tool. It helps quiet the psychological noise that gets in the way of your message. Have you ever been in a situation, perhaps in a tense one, where you're talking to people and you're giving them all the information that they need, and then you open it up to questions, and by question number one, you're thinking, hello, did you hear me? Didn't I just say that over the last 5 minutes? The reason they didn't hear you is because they have a loop going on in their brain that's saying, do you get it? Do you get it? Do you understand how this is affecting me and my life and my family and my community? Do you get it? An expression of empathy within the first 30 seconds of speaking to people who are at risk will help quiet that loop so they can hear your message. Remember, the right message at the right time from the right person. You may think you're communicating. You are not communicating if they don't hear you. An expression of empathy helps you get that message across when it's most important. And it builds trust. And if we don't have trust, we're not going to be believed, and we're not going to be able to do what we're supposed to do. Again, I said earlier that Zika is, there's an advantage in this in part because we can give people things to do. We have a list of things already, depending on the risks that people might be facing that they can do. I'm borrowing from my friends in Georgia. I just love this idea of tip and toss. That's great, you know? If all else fails, everybody can tip and toss, you know, within reason. And then show respect. And more than anything, that just means treating people as if they are adults, giving them the information that you would want if you were in that situation. I do say sometimes give it, you know, put it to the mom test. If you're going to go give your mom this information, why aren't you giving everybody's mom that information? One of the mistakes we make sometimes in our response is not sharing information quickly enough and completely enough. Every threatening situation, every emergency, you can expect questions like this to come up. There are going to be some hard questions with Zika. We have a number of issues that we're dealing with today. We're talking about issues related to poor birth outcomes, to delayed pregnancy, long-term contraception, to pregnancy termination, environmental concerns, travel advisories. All of those are hard questions waiting for us to answer and for you to answer in your jurisdiction. So we could do what we typically do and get straight to the facts. Let me give you an example. I have it here. Here's the way the question might come to you. Are you telling women not to get pregnant until we have a vaccine? Or it could be like this. Why aren't you telling women not to get pregnant, considering the risk for birth defects, right? It could come to you either way. So how do you answer that question? Well, most of us want to jump right in on the facts. We could start with more than half of pregnancies are unplanned. The best way to reduce unintended pregnancy among sexually active women is to use effective birth control correctly and consistently. And we might go a little further with those facts. Women who choose to become pregnant or are already pregnant should strictly follow the steps to prevent mosquito bites and sexual transmission of Zika virus. Those are true. Those are facts. That's what we say. But is that going to be a satisfying answer to a question like this and some of these other hard questions? I suggest not. And so I would recommend that you do something I call unpacking the question. What is it behind that question? What concerns, what fears, what values are behind that question that is leading someone to ask you that? It could be that they're wanting reassurance from authority that it's okay or it's not okay to be pregnant. They may be looking for an answer on just how big the threat really is. Really? Is it important enough that you want me to think about this? And it could be that they're just looking at issues related to their values and how their values correlate with yours. These are going to be hard questions. We need to acknowledge that these are hard questions. We need to acknowledge there isn't one answer that works in every situation. And perhaps another way to go about doing that would be to start with some of these principles of crisis and emergency risk communication. Start with a little softer approach and understanding that there might be something behind that question besides an attack, because sometimes that's the way it feels. So you might go, there are important decisions about Zika that scientists and researchers are trying to answer right now, right? I mean, that's a soft way to get into it. While it makes us uncomfortable to not have all the facts, that's a little bit of empathy, we have an obligation to share what we know to help people make decisions. And then you may go on and talk about the facts that you wanted to start with initially, but just softening a little bit, acknowledging that there are differences and that people have an emotional connection to that question. And then finish up with, we know many factors go into couples' consideration about timing of pregnancy. We want them to have the best information about Zika virus as they work through these complex and deeply personal decisions. If you're thinking about this question for the first time, it might be a step too far to go beyond the facts, but I'm going to ask you, work on your empathy muscle. You have time in the planning to think through the hard decisions. We go straight to the facts, we leave out the human factors. We leave out the human factors, we're going to have angrier and more concerned people. They're looking for an acknowledgement of the uncertainty about the emotional toll that this is taking on them and their loved ones in their community in a situation. Anytime people are facing a new decision, and especially if they're facing a decision that has some risk, they're going to ask themselves 4 questions. Frankly, you ask these questions of yourself if you're going out to buy a new car. They want to know, what will I gain by going with this recommendation? What will it cost me to go along with this recommendation? Importantly, what do those important to me want me to do? This is where leaders become very important. You can model the positive behavior that you want in your community, and you can also work with your public information officers to have communication campaigns, to bring partners together, to amplify the voice that suggests that one behavior is more helpful than another, tip and toss. And then people are asking, can I actually carry it out? Think about the person returning into a northern state in the U.S. who had been in an area where Zika is transmitting right now. And we've asked them to wear insect repellent for 3 weeks. Do you think they might be working through this process? I think they might. So what we need to do is communicate in a way that we increase the benefit, reduce the cost. What do people important to me think I should be doing? And then doing what we can to ensure that they can carry it out. Everything we're talking about in crisis and emergency risk communication is really a way to do a couple of things: build trust and credibility and reduce barriers to communication so that we can get messages to people in a way that they can use them. And trust is vitally important. Mistrust is a consequence of promises unfulfilled. And it's very important why we suggest that you don't overpromise, even in an implied way, early on in a response. What happens if we're not trusted? The right person at the right time with the right message can save lives. I think the reverse could be true. So how do we act more trustworthy in a response? We do so by sharing information early. This is the planning time. We know the hard questions are coming. We know through our planning that there are decisions that need to be made in the community. We need to be thinking about the communication as we're thinking about the other aspects of the response. Selecting a spokesperson who is never condescending. You as a leader may be that spokesperson. You may be deciding who is. Condescension is the #1 failure in good communication in a response. And that's why I'm suggesting that we check ourselves in terms of judgment in situations where we're feeling overburdened by perhaps the questions and the complexity of the issues that we're dealing with. Why do people become angry? These are common reasons. I think you can read for yourself where the Zika virus and the response to it may engage some of these concerns. So how do we try to keep conflict from taking over in an event? Oh, there's that seeking input early again. Community engagement around Zika response is vitally important. And that means involving them early enough that they really do feel that they have a voice in this. You can do it through social media. You can do it through town hall meetings. You can do it in a number of ways, whatever is right for your community, whatever size it might be. But starting that process early is important. And as Dr. Lyon Daniel said, we do have resources and tools to help you do that. We also have training opportunities for your PIOs, and I encourage you as leaders to encourage your public information officers to engage in that training whenever possible. This is a slide that I put in specifically for the conversation we're having here today. I thought, if I were a leader, what would be some of those things that nobody tells you but you'd really like to know about your communication? The things that haven't been written perhaps someplace else? And this is my list to you. Say, I don't know, when you don't know. It's counterintuitive, but it increases your credibility in these kinds of situations. Because then people are more confident that if you're willing to say you don't know when you don't know, that the other stuff you're saying you really do know. So don't walk away from that. Don't try to out-talk the question when it comes to you. And I don't know can be very effective. Avoid bureaucratic speak. I'm talking jargon. I'm talking medical terminology. I'm talking all of that. Avoid it. Plain language is the best language to speak to people when they're under threat, when their emotions are high, when the potential for conflict is high, because you want to be very clear. CDC has tremendous tools and training on health literacy and plain language to help you and your public information officers around plain language. It really takes a great deal of intellect to give messages in plain language. 6 words I never want to give up, based on what we know now. This will save you when we're at the early stages of a crisis response or outbreak response, when there are more questions perhaps than answers, and predict that things can change, that things will change. And one of the ways to do that is to say, based on what we know now. Raise questions that don't have answers so that you get credit for acknowledging that those questions do exist. And as leaders, be prepared to share a little more than you think is right. Expect criticism, that's what it means to be a leader. And inspire others. The transformational leader in a crisis is that leader which can inspire others to do more with less self-interest. And I do believe, and I have witnessed, that the right message at the right time from the right leader working with their public information officer can save lives. Now it's my pleasure to introduce my esteemed colleague, Dr. Leonard Marcus.
Thank you, Barbara, and thanks to all of you for your service. So our topic here is leadership. And there's a critical leadership lesson that I hope you will take from this session. And it is the leadership pivot point. So we've learned a lot about how Zika is emerging and evolving. You as a leader will pivot as the science evolves, as cases emerge, and as we gain more experience. And the critical question is when you pivot. You don't want to pivot too early. You certainly don't want to pivot too late. And this Zika Action Planning Summit in and of itself is a pivot. So let's look at some of the key factors in leadership that you'll be thinking about as you're moving forward over the next few months. Dr. Frieden talked about the importance of a Zika coordinator. And actually what we need are a lot of Zika coordinators in states and in communities. We call this meta leadership. And what the prefix meta references is looking very widely at what's happening and then acting very widely on what needs to be done. There are 3 dimensions to meta leadership practice. First, it's you, the leader. You're it. It's your emotional intelligence, as Barbara was talking about. It's your ability to understand what's going on, and you set the tone. If you're calm, other people will be calm. If you're panicked, other people will be panicked. So as a leader, your ability for your own balance and self-discipline, critically important. The second dimension of meta leadership is understanding the situation, which means you as a leader have to be up on what's going on, and you as a leader will set the tone on what needs to be happening. The third dimension of meta leader is building connectivity of action. And that's to the people who are working on your staff. You're the boss, so you're subordinates, so you're leading that crowd of people. Very importantly, you're also leading up. Many of you are subject matter experts leading up to elected officials or appointed officials. And sometimes the most difficult part of the leading up is truth to power, letting people know what's going on and what needs to be done about it. Next is being able to lead across. So that means you're leading within your agency, all the different departments and offices that need to be working together and oriented as part of that leadership pivot, and then leading beyond to communities, to other organizations, so that it's truly a unified effort. Now, as we've studied leaders in the midst of all sorts of crises, one of the factors that we found is the glue that keeps people together is this simple line: how can I make you a success? And if everyone who's part of this effort is looking toward one another, towards that common definition of success, we're most likely to succeed in our response to Zika. Now, we talked about the situation. And one of the particularly perplexing aspects of Zika is what we know and we don't know. Now, some of that are the known knowns. and the communication that Dr. Reynolds talked about is critical in letting people know this is what we know and this is what you should be doing about it. Another important question are the unknown knowns. My colleagues at the Harvard School of Public Health this week came out with survey results, and many people of childbearing age don't understand what Zika is about, how it could affect them, and what they ought to be doing about it. So being clear as a leader on the unknown knowns and getting that information out will be critical. Now again, as Dr. Reynolds pointed out, what's really perplexing about this response are the known unknowns. We know that there's a lot we don't yet know about Zika. And being able to say, I don't know, letting people know what we're doing to learn more is going to be critical. And in terms of leadership pivot points, the most perplexing puzzle here are the unknown unknowns. We could discover something, problems could emerge that we can't even predict right now. And so as we're trying to understand this situation, it's critical as a leader that you're clear on what's known, what's unknown, and then how you will chart that out as you go forward in creating those leadership pivot points. Now, the connectivity is absolutely important. You know, one of the things people say is, well, what we need to do is to break down the silos. Now, I've lived in Boston for over 40 years. I grew up in Wisconsin. In Wisconsin, we think silos are good things. You store your corn and hops in silos. You actually want to have very strong silos. And on this particular topic, we have a lot of different silos, and part of your meta-leadership responsibility is building connectivity of effort among all those silos. Amy Pope this morning talked about the importance of a whole of nation, whole of community response. That should be our theme. So we have the government silo and all the different agencies, and we have federal, state, and local. We also have the media silo. And the media actually can be an important friend and ally in helping people understand what it is that we're dealing with, including social media. Imagine people of childbearing age, women and men, through social media, building connectivity of efforts so that we're all aware and we're all working together on this. The business community. Many times people in the business community will come to us and say, well, why didn't they just ask? We want to help out. Or others aren't aware of what the business community could do. So how do we make the business community a part of it? And then the nonprofit community, faith-based organizations, humanitarian organizations, and the community itself. So building this whole of nation approach to the Zika response will help us when it's time to pivot, because people will feel involved, they'll be knowledgeable, and that's really the effect that leaders will be able to achieve. Now, I want to share with you very briefly research that we had done on the response to the Boston Marathon bombings. Of course, happened in our own backyard. And one of the things that was fascinating about this response, when we were interviewing all the leaders, is that while there was a lot of coordinated activity, when we interviewed them one-on-one, we found out that nobody was in charge of the overall operation. There were a lot of people in charge of their specific organization, but nobody was in charge of the overall operation. Think Zika. No one agency, no one organization is going to be in charge of everything. It's going to require us to work together very well. And what we discovered as we were interviewing these leaders is something emerged akin to swarm intelligence. Now, there's a whole field that studies how birds and bees and termites figure out how to work together very well. And they do it based on all following the same rules and the same principles. So we went through all of our interview notes and said, well, if swarm intelligence were operating in the response to the Boston Marathon bombings, what would the rules and principles be? And how could they be practiced by leaders? So let me first give you the 5 principles and rules of swarm leadership, and then let's apply them to what you as a leader can do in your pivot points through this response. The first was unity of mission. In Boston, it was all save lives, and everyone was clear that was number 1. The second was generosity of spirit and action. People wanted to help out. When the help was given, it was appreciated, and it really created multiple multiplier effects so that a lot was done and a lot of people were working together. The third principle of swarm leadership is everybody stayed in their lanes and helped others succeed. So this is my job, This is where my expertise is, and how can I help you in your lane get your job done given your expertise? So everybody stayed in their lanes, helped others succeed. The fourth rule of swarm leadership is no ego, no blame. Interestingly, this came up later in the interviews, and everyone came back afterward and said this was the most important. If one person had tried to take the credit, or if people started pointing fingers, it would have broken that swarm leadership. And finally, a foundation of trusting relationships. People knew one another, and they were oriented to work together. How do you translate these principles and rules of swarm intelligence to your work as a leader, especially at those pivot points? So first, let's get everybody on board. Striving to address the Zika response, the generosity of spirit, making sure that when people make contributions, they're recognized and acknowledged for those contributions, create the multiplier effect. Everybody staying in their lanes so that everybody knows who's got what job. There are no gaps. There's less likely overlap. The no ego, no blame, that's emotional intelligence. That's people acting like adults. And we saw a lot of it in Boston, and it's absolutely a real important phenomenon for leaders. And finally, people now can get ready for the pivot. So reach out to people who might be a part of this response so that when it's time to pivot, you're all ready to go. The interesting thing in Boston is what we found is that there was order beyond control. Many times people think if you're going to do a large response, it requires command and control. But when you have so many people and so many different organizations, even reaching out to social media and people self-organize to ensure that their social network is all informed, especially childbearing age, all informed about what needs to be done is absolutely critical. So what did we find among those leaders in Boston, and what do we need to find here in the Zika response? How can I make you a success? And if that becomes the overriding theme of everything we're doing out of this summit and everything you bring back to communities, we will have the best possible response. Leadership Pivot, thank you for your service.
Thanks very much for those wonderful presentations. And we keep talking about communication today. And I just also wanted to give a shout out to all of the viewing parties that we know are actually happening nationwide. So while I mentioned earlier of the 2,500 different registrants, we've been hearing from folks that they are gathered together in large groups across the nation. So thanks for everybody for participating in those viewing parties.